As people grow older, mobility can become more challenging. Conditions such as arthritis, joint pain, balance issues, and reduced stamina can make walking long distances difficult. For many seniors, something as simple as crossing a large parking lot can be exhausting or painful. Because of this, many older adults wonder whether they can qualify for a disabled parking permit. The good news is that senior drivers can obtain a disabled parking permit if they meet the medical eligibility requirements set by their state. Age alone does not automatically qualify someone for accessible parking privileges. However, many age-related medical conditions can meet the criteria if they significantly limit mobility. A disabled parking permit allows qualified individuals to park in designated accessible parking spaces. These spaces are typically located closer to building entrances and provide additional room for entering or exiting a vehicle safely. For seniors with mobility limitations, these spaces can make everyday tasks far more manageable. It is important to understand that eligibility for a disability parking permit is based on medical conditions rather than age. Many seniors develop health conditions that affect their ability to walk comfortably or safely. These conditions may include arthritis, heart disease, lung disease, neurological disorders, joint replacements, or chronic pain. For example, arthritis is one of the most common conditions affecting older adults. Severe arthritis can cause joint stiffness, swelling, and pain that makes walking long distances extremely difficult. In cases where arthritis significantly limits mobility, a healthcare provider may recommend applying for a disability parking permit. Heart and lung conditions can also qualify. Individuals with certain cardiovascular or respiratory conditions may become short of breath or fatigued after walking only short distances. Accessible parking allows these individuals to reduce the physical strain associated with reaching building entrances. Balance issues and neurological conditions are also common among older adults. These conditions may increase the risk of falls, especially when navigating crowded parking lots or uneven surfaces. Parking closer to entrances can help reduce this risk. The process of obtaining a disability parking permit typically begins with a medical evaluation. A licensed healthcare provider must verify that the individual has a qualifying condition that limits mobility. During this evaluation, the healthcare provider may review the patient's medical history, current symptoms, and physical limitations. If the condition meets the state's eligibility requirements, the provider will complete a portion of the permit application confirming the diagnosis. Once the medical certification is completed, the application must be submitted to the appropriate state agency, usually the Department of Motor Vehicles or a similar transportation authority. Depending on the state, applications may be submitted in several different ways. Some seniors choose to visit a local motor vehicle office in person. Others may prefer to submit their application by mail. Many states now allow disability parking permit applications to be completed online, which can be especially convenient for seniors who may have difficulty traveling or waiting in line. After the application is reviewed and approved, the permit is issued. The permit may be mailed to the applicant's home or provided during an in-person visit depending on how the application was submitted. Once received, the permit must be displayed clearly whenever the vehicle is parked in a designated accessible parking space. Display requirements vary slightly by state, but the permit must always be visible, so parking enforcement officers can confirm that the space is being used legally. It is also important to remember that disability parking permits are issued to individuals, not vehicles. This means the permit can be used in any vehicle as long as the eligible individual is present in the vehicle. For example, if a senior is riding with a family member or friend, the permit can still be used as long as the senior is either driving or a passenger in the vehicle. However, the permit should never be used by others when the eligible individual is not present. Misuse of a disability parking permit can result in fines, penalties, or revocation of parking privileges. There are typically two types of disability parking permits available: temporary and permanent. Temporary permits are issued for short-term conditions that limit mobility, such as recovery from surgery or injury. These permits usually have an expiration date that corresponds with the expected recovery period. Permanent permits are issued for long-term or lifelong conditions that significantly affect mobility. Many seniors with chronic conditions may qualify for permanent permits if their healthcare provider determines that their mobility limitations are ongoing. Even permanent permits may require periodic renewal depending on state regulations. Renewal helps ensure that the permit holder's information remains accurate and that eligibility requirements continue to be met. For many seniors, obtaining a disability parking permit can significantly improve daily life. Accessible parking spaces reduce the distance required to reach entrances, making it easier to run errands, attend medical appointments, and participate in social activities. Reducing walking distance can also help conserve energy and reduce pain for seniors managing chronic conditions. Another benefit of accessible parking is the additional space provided around the vehicle. Accessible parking spaces are often wider than standard spaces and may include adjacent access aisles marked with diagonal striping. These access aisles provide extra room for safely opening vehicle doors and exiting the vehicle. This can be especially helpful for seniors who move more slowly or require mobility aids such as canes, walkers, or braces. In addition to improving safety and comfort, accessible parking helps support independence. Many seniors value their ability to remain active and self-sufficient. A disability parking permit can make it easier to maintain that independence by reducing physical barriers that might otherwise limit mobility. Accessible parking permits are an important accessibility tool designed to support individuals with mobility challenges. For seniors who meet the medical eligibility requirements, obtaining a permit can make everyday travel more manageable and less physically demanding. If you are a senior experiencing difficulty walking or managing long distances due to a medical condition, speaking with your healthcare provider about a disability parking permit may be a helpful step. With proper medical certification and a completed application, many seniors can obtain the permit they need to access accessible parking spaces and continue navigating daily life with greater comfort, safety, and independence. We hope you found this information helpful. If you need assistance obtaining a handicapped placard or plate and want to avoid the hassle, paperwork confusion, or trying to coordinate a doctor's appointment on your own, visit handicappedparking.com. Our platform connects you with licensed doctors online from the comfort of your home, making the process simple, secure, and stress-free. If you're facing any challenges with your disabled parking permit, let us know, and we'll see what we can do to help you regain your traveling freedom. Our goal is to give you the knowledge and support you need to improve your quality of life. Be sure to follow this channel for more answers to your handicap parking questions, and feel free to leave a comment below. We're always happy to help. Thank you for watching, and we'll see you in the next video.